Welcome, everyone. Welcome to the Healthcare and the ADA, Including People with Disabilities webinar series. I'm Katie Warden, the director of the Northwest ADA Center, and I'll be your moderator for today's webinar. This series of webinars is brought to you by the Pacific ADA Center on behalf of the ADA National Network. The ADA National Network is made up of 10 regional centers that are federally funded to provide training, technical assistance, and other information about the Americans with Disabilities Act. You can reach your regional ADA center by dialing 1-800-949-4232. Captioning. So real-time captioning is provided for this webinar. The caption screen can be accessed by choosing the closed caption icon in the meeting control toolbar. This webinar series is intended to share issues and promising practices in healthcare accessibility for people with disabilities. The series topics cover physical accessibility, effective communication, and reasonable modifications of policy issues under the Americans with Disabilities Act. These webinars occur every other month on the fourth Thursday of every other month at 2:30 p.m. Eastern, 1:30 Central, 12:30 Mountain, and 11:30 Pacific time. By being here, you are on a list to receive notices for future webinars in the series. The notices go out 4 weeks before the next webinar and open that webinar to registration. Next slide, please. So listening to the webinar instructions continued. If you do not have sound capabilities on your computer or prefer to listen by phone, dial 1-669-900-9128 or 1-646-558-8656. The webinar ID is 839-9931-0598, and this is not a toll-free number. At the conclusion of today's presentation, there will be an opportunity for everyone to ask questions. You may submit your questions using the chat area within the webinar platform. The speakers and I will address them at the end of each section, so feel free to submit them as they come to your mind during the presentation. So you may type and submit questions in the chat area text box or press Alt-H and enter text in the chat area. If you're listening by phone and not logged into the webinar, you may ask questions by emailing them to adatech@adapacific.org. Technical assistance. If you experience any technical difficulties during the webinar, send a private chat message to the host by typing in the chat window. Type your comment in the text box and enter. Keyboard Alt-H to access chat box via keyboard keys, or email adatech@adapacific.org, or call 510-831-6714. Okay. Today's ADA National Network Learning session is titled Accessible Electronic Communication in Healthcare Settings. Today's speakers are Emily Schumann, who is the director of the Rocky Mountain ADA Center, Jerry Davison, who is the director of the Pacific ADA Center, and Pat Schwartz, who is the lead technical assistance specialist at the Pacific ADA Center. I'll now turn it over to you, Emily.
Thank you. Let's go to the next slide, please. So once again, today we're discussing accessible electronic communication settings in accessible electronic communication in healthcare settings. Again, my name is Emily. I'm a white woman in my late 30s, wearing a gray cardigan against a green background, and I have long brown hair. Next slide, please. So if you're familiar with the ADA National Network, you know we always have to include this little bit of a disclaimer, which is just to remind everyone that the information you're getting today should be considered informal guidance and not formal legal advice. The Rocky Mountain ADA Center is operated by the University of Northern Colorado and funded under a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research. And our service area consists of Colorado, Utah, Montana, North Dakota, South Dakota, and Wyoming. Next slide. So just a little bit more information about the regional centers for anybody who's not familiar with the ADA National Network. Once again, there is a center that serves each state in the nation. You can reach your local center by calling 1-800-949-4232. All centers offer technical assistance or answers to questions. We can refer and network to other organizations to help further assist you if we're not able to. We conduct research on the ADA implementation and barriers to implementation. We also provide training, publish and share materials, and have a robust social media presence. So we certainly recommend that you connect with us following today's training on your favorite social media platform. Next slide. So just to make sure you understand what you're going to get today, we have some learning objectives. Number one, we're going to learn the basic legal requirements to communicate effectively with people with disabilities. We're going to understand how people with disabilities use assistive technology to interact with the digital environment. We'll look at the principles of digital accessibility, including plain language and easy read. And we'll discover a few online tools that will help make written communication easy to understand. Once again, please do ask your questions and we will address those throughout the session today. And if you have a question that comes up later, don't hesitate to reach out to your local center and we will be happy to answer your questions at a later time. Next slide. So just a reminder, we're talking about the Americans with Disabilities Act today. So I want to remind everybody that this is a civil rights law, which means that it's a legal guarantee of equal opportunity in areas of public life for people with disabilities. The ADA prohibits discrimination on the basis of disability, and it also promises equal opportunity to participate in society, and that includes accessing healthcare. The law was passed on July 26, 1990, and signed into law by President George H.W. Bush. His famous quote as he was signing the law is, "Let the shameful wall of exclusion finally come tumbling down." And this is, this quote is so famous because it really acknowledges that for a long time, people with disabilities had been left behind and held back from just simply participating in society along with everyone else. Access to healthcare is obviously a really important service and thing that we all need access to, including people with disabilities. Next slide. So as we talk about the ADA, it's important to remember the ADA's definition of disability. So the ADA defines a person with a disability as having a physical or mental impairment that substantially limits one or more major life activities. The ADA also prohibits discrimination against those with a record of such an impairment and those who are regarded as having such an impairment. So it's important to note that in the context of the ADA, disability is a legal term rather than a medical one. And so you might find that this definition is different than what you would see from Social Security, a medical environment. This is a legal definition, and it's meant to be broad in order to provide protection to as many people as possible. Anybody who needs the ADA's protection should not have a hard time meeting the definition of disability. Next slide. I always think it's important to discuss the prevalence of disability. So, according to the Centers for Disease Control and Prevention, more than 1 in 4 people in 1 in 4 adults in the United States have some type of disability. So that represents about 28.7% of the adult population in America. That can be further broken down into types of disability. So 13.9% of adults in America have a serious cognition difficulty, which means that they have serious difficulty concentrating, remembering, or making decisions. 12.2% of adults in America have a mobility disability that impacts their ability to walk or climb stairs. 7.7% of adults in America have an independent living disability, which means that they have difficulty doing errands alone. 6.2% have a hearing disability. So that would be deafness or serious difficulty hearing. 5.5% have a vision disability, meaning that they're blind or have difficulty seeing. And 3.6% have a self care disability, which means that they have difficulty dressing or bathing. Next slide. So, as you may know, the ADA is divided into 5 main sections or titles. Could think of them as chapters. And your entity probably has obligations under multiple titles. When we talk about healthcare, we're usually looking at entities that fall under that Title II, which applies to state and local governments, or we're talking about organizations that fall under Title III, which are businesses or places of public accommodation, but are not necessarily publicly funded. So those two titles, Title II and III, have some slight differences, but the general responsibilities and requirements are fairly closely aligned. Next slide. So to cover some of those general ADA responsibilities, there are a few overarching responsibilities it's important to note. So first of all, the ADA requires that we ensure equal opportunity to participate and benefit from the goods, activities, and services that we offer within our entities. The ADA also requires that we make reasonable modifications in policies, practices, or procedures in order to allow people with disabilities to participate. The ADA requires that we provide effective communication, including by offering auxiliary aids and services when necessary to eliminate those communication barriers. And I will break down some of those concepts in a little bit more detail. And finally, the ADA requires that we provide accessible facilities and programs. Again, the degree to which this is required depends a little bit on whether you are a Title II organization or Title III. And that would be a topic for a different session. But I think it's important to note that the ADA sets the minimum standard for compliance. So sometimes the minimum standard is, what we're going for, but there's nothing that ever prevents us from going above and beyond what the ADA requires. Next slide. So we're going to talk about effective communication before we get into, some practical tips for digital environments. Go to the next slide. So, as we know, many people with disabilities have disabilities that affect hearing, their ability to see or speak. And so, those are broadly communication disabilities and result in the person with a disability using a different method of communication. So the obligation under the ADA is that the information we provide to people with disabilities should be as clear and understandable as it is to people who do not have disabilities. So we have to make sure that our communication with people with disabilities is effective, in other words. So very prominent keyword with this concept is that the communication needs to be effective, meaning that everybody understands what's being said and we've assigned the same meaning to what's being contained in that communication. Of course, with the ADA, there are always exceptions. So we don't have to offer an auxiliary aid or service that would result in a fundamental alteration to the environment that we're in or to the good or service that we're offering. And we don't have to provide auxiliary aids and services that result in an undue financial and administrative burden. Remember, those are narrow exceptions. It's important to clearly document when you have made those decisions and interact with people with disabilities in good faith. So really try to find a way to facilitate that effective communication if possible. Next slide. Auxiliary aids and services, can include all kinds of uh, programs, devices, and services. There's not an exhaustive list of auxiliary aids and services, but there are some that are pretty common. Things like large print, braille, sign language interpreting, providing audio recordings when we normally would provide written information, providing printed information when we normally provide that verbally, offering assistive listening systems so that people can have amplified audio directly into their ears, open and closed captioning services, our auxiliary aids and services, video relay services, screen readers. Those are some pretty common examples of auxiliary aids and services. So we have auxiliary aids and services on this webinar. We have sign language interpreting as well as captioning. So when a person requests an auxiliary aid or service, it's important that we give primary consideration to their preference or what works best for that person. We can consider the nature, length, and complexity of the communication as well. So in a medical situation, that's typically highly complex, and the nature of it is pretty grave and important. So usually in healthcare situations, we always want to provide the auxiliary aid and service that the person requested to make sure that we have the ability to facilitate that effective communication. Remember that entities that have obligations under the ADA must pay for and provide those auxiliary aids and services. And there should be no surcharge placed on a person with a disability. So we do have to absorb those costs as well. Next slide. So effective communication requirements also apply to the companions or associates of the person with the disability. So this could be a family member, a friend, or an associate of the person who's seeking access to your services, as long as you would normally, and it would normally be appropriate to communicate with that person. So an example of that would be perhaps your patient is not a person with a disability, but their spouse does have a communication disability. So if it would normally be appropriate in that situation to communicate with the spouse of the patient, we would have to provide an auxiliary aid or service to facilitate that effective communication with the spouse, even though the patient themselves does not have a disability. Next slide. So when we're talking about effective communication, this also applies to all of the digital services and information that we put out there. Many people with disabilities, just like all of us, are accessing information online in these digital environments. So digital accessibility is by extension another form of communication that we have to make sure is effective. Remember that if in our digital environments are not accessible, people don't have equal access to information. So going back to those overarching goals of the ADA, the goal is to provide equal access and to facilitate effective communication. So we can think of all of the various examples that happen in a healthcare environment where people are, doing business essentially in a digital environment. So things like making their healthcare appointments through an online portal, documenting test and imaging results, reviewing those results through their online portal, communicating with their care team can take place, in digital environments. Paying bills happens mostly in digital environments. So there are lots of environments in the healthcare industry where people need to have accessible digital communication in order for it to be fully accessible to them and effective for them. Next slide. So I think it's helpful to just get an understanding of the legal landscape as it applies to digital accessibility. So when we think of effective communication, again, we often think of that it applies to our in-person interactions, but effective communication is also inclusive of our digital environments as well. So Title II of the ADA, which remember is that title that applies to state and local governments, this was recently updated to adopt the Web Content Accessibility Guidelines as the enforceable standard. And entities have 2 to 3 years to comply depending on their population size. Next slide. Under Title III of the ADA, which applies to those places of public accommodation that do not receive any public funding, there is no technical standard that's enforceable yet. However, we still default and defer to those non-discrimination and effective communication obligations. So the Department of Justice has consistently taken the position that the ADA's requirements apply to all of the goods, public services, privileges, and activities offered by public accommodations, including those offered on the web. So this is to say that even though if you're a Title III organization, you might not have an enforceable standard for digital accessibility, that doesn't relieve you of your obligation to make sure that your digital environments are accessible. Next slide. So very similarly to the update with Title II of the ADA, Section 504 of the Rehabilitation Act of 1973 was recently updated to, again, make those web content accessibility guidelines enforceable for digital environments. And so the Rehabilitation Act applies to programs and activities that receive federal funding. I know many healthcare organizations do receive some federal funding. So you would also have obligations under the Rehab Act due to that. And so these updates do closely align with what I mentioned for Title II of the ADA, and they also add requirements for kiosks as well, self-service kiosks. Next slide. We also have a very similar update for the Affordable Care Act. So again, this is new as of May of 2024 and also applies to health programs and activities that receive funding from the Department of Health and Human Services, adopts those web content accessibility guidelines as the enforceable standard for digital communications. So again, that applies to your websites, mobile applications, and digital tools, and closely aligns with the Rehabilitation Act and the ADA, as I mentioned. Next slide. So the bottom line with building that kind of legal landscape is just to really, let everybody know that the web content accessibility guidelines are required by several laws. So this is a really great guideline to work from if you're wanting to make your digital environments more accessible. Next slide. So what are the web content accessibility guidelines? What does this mean exactly? So I won't get too deeply into this, but I do want to give you a few pieces of information. So we'll go to the next slide. So the web content accessibility guidelines are simply a set of principles, guidelines, and measurable success criteria that build a framework for creating and maintaining accessible digital materials and interactions. So these are developed through a consensus process, which means that the people with disabilities have been included in the development of these guidelines to make sure that they really will work for people with disabilities if they're followed. Next slide. So these guidelines are developed by the World Wide Web Consortium, or W3C. Again, they are the basis of most web accessibility law. There's several versions of the Web Content Accessibility Guidelines. Version 2.1 is the version that most laws currently require. However, there is version 2.2 that is out now, that was published in October of 2023. It's important to note that if your web content or digital content conforms to that 2.2 version, it will also conform to 2.1. So they are backwards compatible in that way. And the Web Content Accessibility Guidelines use 4 principles that really provide the foundation of web or digital accessibility. So that's being perceivable, operable, understandable, and robust. And that spells the acronym POUR. And so these 4 elements really make up the overall goal of making web content accessible. So all of the practical tools that I'll share with you today come from these web content accessibility guidelines. So I think it's important that you just have a little bit of foundation of what these guidelines are, where they come from, how they're developed, etc. Next slide. So I'll give you those practical tips, but first I think it's important to make sure everybody understands how people with disabilities interact with digital environments. Next slide. Most people with disabilities, if they have some sort of communication disability, they're using assistive technology to navigate digital spaces. And assistive technology is just any sort of technology, software, hardware, or product system that helps to increase, maintain, or improve the functional capabilities of people with disabilities. Next slide. So there are some common examples that I can share with you. These, again, it's not an exhaustive list. It's just these are some of the most common forms of assistive technology that people with disabilities are using. On-screen keyboards, voice recognition software, screen adjustment programs, and screen readers. So next slide. To expand on screen readers, this is a type of software that allows users that are blind or have low vision to read or listen to the text that is being displayed on the computer. And usually this is done via a speech synthesizer or braille display. So again, screen readers are the interface between the computer's operating systems, its applications, and the user. Next slide. So most screen readers have an output that's verbal, so they will speak aloud the content that's on the screen to the user. However, people who are deafblind can also add a okay, I'm hoping you can hear me now. Please let me know if you're having trouble hearing me. So people who are deafblind often add an additional piece to this assistive technology puzzle where their output is through a refreshable braille display. So this is a type of technology that instead of the screen reader providing an output verbally through a speech synthesizer, the output is in braille. So really cool technology that's used primarily by deafblind people. Next slide. Screen magnifiers, again, another really important piece of assistive technology that some people with disabilities use. So we know that people who are blind often do retain some vision. And so screen magnifiers are really helpful when people have low vision, but are able to see what's on the screen with a screen magnifier. So if we'll go to the next slide. So this is an example of what it looks like to be legally blind, which is 20 to 200 vision. So the example on screen here is a computer window that looks very blurry as it would to someone who had that legally blind vision. Next slide. Similarly, there are multiple examples on this slide of different types of vision, different types of vision loss based on what caused the vision loss. So we have a image of 2 boys holding, balls. And that's the normal vision. And then we have that same picture as seen with different types of vision loss. So diabetic retinopathy, there are blotches of lost vision throughout. With myopia, there's some blurring around the edges of the field of vision. With glaucoma, we see darkness again around the edges of the vision, or what you might think of as tunnel vision. You can see the boys' faces, but not much of what's around them. With cataract vision loss, the entire image is quite blurry. Macular degeneration, you can't see the boys' faces at all, and then what's around them is pretty blurry. And then retinitis pigmentosa, again, kind of that classic tunnel vision, where you only have a small pinhole of vision left. So again, some of these assistive technologies are really beneficial for people who have low vision or some vision loss, but do retain other vision. So next slide. And then finally, on the note of assistive technology, there's lots of technologies that are available for people who have physical or mobility disabilities, and may not be able to, access the typical hardware that we use on a computer. So they may have limited muscular control, or have paralysis or lack of coordination. So they may not be able to move a computer mouse or access a keyboard. So there are some assistive technologies that can be used where people use a mouth stick or a sip and puff device, and they can navigate their computer using a device that they use with their mouse. There's also eye tracking, which is what the person on screen in the picture on screen here is using, where she's able to navigate around her computer using software that is tracking her eye movements. And then she's able to use blinking gestures to do things like click on links, or pause and unpause a video. So again, I think it's really helpful to just understand that when we put it all together, people with disabilities use different types of assistive technology to navigate the digital environment. And when we develop our digital content in ways that are accessible, what we're doing is we're making it compatible with the various types of assistive technology that people with disabilities are using. So if we'll go to the next slide. Now that we understand, how all of these things go together, we can start looking at these characteristics of accessible content. Next slide. So the first characteristic of accessible content is plain language. I'm not going to spend much time here because we're going to hear a lot more about that. When I'm talking about accessible content, these principles will apply across the board, no matter how you're authoring this content, right? So these principles apply to the documents you create, to the emails you send, to what you put on social media. So these really are true characteristics that work across the board. So plain language, in brief, short, simple, and to the point language, keeping it conversational, familiar, and actionable. Again, you're going to get a lot more about plain language shortly. Next slide. So looking at our typeface, it's important that we use a sans serif font. So a serif font has tails, or sort of decorative edges on the edges of the text, whereas sans serif fonts really just have a clean block edge on each of the letters. And so it's important to use a sans serif font for people who magnify their screen, because if we're using a serif font, when people magnify their screen, that text can bleed together and get blurry. So that's why a sans serif font is the most accessible choice. So sans serif or non-serif fonts would be things like Arial, Calibri, whereas a serif font would be like Times New Roman and Century. Whenever possible, you want to keep your fonts consistent. It's helpful to limit or omit the use of all capital letters, italics, and scripts. And again, this is because it's often not compatible with people's assistive devices. So each assistive device, each screen reader would handle this differently. And you just never know how somebody's screen reader would handle it. So it's best practice is just to limit or omit the use of those types of typeface. So when it comes to size, it's helpful to keep the body of your text no smaller than 12-point font. And if you're doing footers, it should be no smaller than 9-point font. Next slide. So anytime you're authoring content, no matter where you're authoring this content, you always want to use the built-in styling tools that are available to you in that authoring program. So for example, the example we have on the slide here is the navigation ribbon in Microsoft Word, where you can see that there are many different styling tools available to do things like add headings, make bulleted lists, add a title to the document, format your text. It's really important that you use these built-in styles because assistive technology can actually infer meaning from the document structure and the formatted characters when you use those styles. So really what's happening is we're providing some background coding for compatibility with those assistive technologies. Next slide. So heading structures are really important. Headings help to organize our content and make sure that people can find information easier. Assistive technology can't recognize that it's a heading if you're just formatting the text stylistically by using bold, italics, or various font sizes. So again, we really want to use those built-in styling tools that we have access to in our authoring programs to make sure that that coding takes place in the background, so that assistive technology can recognize what the meaning is of this particular element on the page. People can also navigate documents by headings. So if a person wants to just quickly scan what's in that document, they can scan the various headings in the document, and that really helps a person be able to find what they need quickly, rather than having to listen to their screen reader read everything, start to finish in that document. Next slide. So when we're using tables, it's important to use tables appropriately, right? So using them only to present information, and not as a method of controlling the layout or alignment of the information in your document. You want to make sure that you have identified your column or row headers. It's also helpful to add a summary, caption, or alt text to your table for somebody who might not be able to access the table fully. It's also important not to merge or split cells, because screen readers will keep track of where they are in a table based on counting through the cell rows and cells. So when we merge and split cells, the screen reader can lose track of where it is, and then the table starts to lose its meaning as it's presented to the person with a disability. Next slide. So again, when we're doing something like a list, we want to use those built-in tools available to us in our authoring programs. So making sure that we are using those built-in commands for numbered lists or bulleted lists, rather than just doing tabs or dashes to create the visual appearance of a list. But again, that's not going to be meaningful for a person's screen reader and may result in a lack of accessibility. So use those built-in tools and commands to make sure that it's got that background coding. Next slide. So alternative text for images is another big characteristic of accessible documents. So again, an assistive device or technology can tell a user that an image is present in the digital environment, but it can't tell the person what's in that image or why that image is there, what's meaningful about it. There are technologies that are getting better at, identifying what's in images, but they're not reliable at this point. So we always want to manually enter alt text. Remember, your alt text should be brief and clearly expressed. It should account for the context or why this picture is here, what's meaningful in the picture, but it doesn't need to be overly verbose or descriptive. And again, be very cautious of any automatically generated alt text tools that are out there, as they're often not reliable, and they often don't have the capability of describing why the image is meaningful in that context. So generally speaking, I have an example here where too much alt text for the image on slide would read Belgian homemade waffles covered in blueberries and rainbow colored sprinkles on pink plates with embroidered napkins and a cup of tea with milk and a teapot all laid on hexagon white tiles. So very descriptive, but that's probably a little too much if we're just using this image for general purposes. So a more appropriate uh, amount of alt text would just be to say appetizing breakfast of waffles with toppings and tea. Next slide. So again, your alt text will change, depend on the context and the purpose of why that image is there. So in this example, the image is a chest x-ray. So if I'm doing alt text that's medical related, my alt text could read chest x-ray showing a cloudy area in the upper right lung with no signs of collapse or fluid buildup. The heart size, bones, and soft tissues appear normal. So that's a fairly good alt text in a medical related context. If I was just using this image for general purposes, I could say standard chest x-ray showing the lungs, heart, ribs, and surrounding soft tissues. Next slide. So captioning, when we're providing digital information to people, we know that captioning is very important and critical for people who are deaf or hard of hearing, and it can often be really necessary also for people who have cognitive disabilities. So we always want to make sure that any video content that we're putting out there has captions available. There's different ways to do captioning. They can be overlaid on the video and not able to be turned on or off. That's called hard captioning. Or we can do closed captioning, which is like what we have in the Zoom environment here, where we can turn the captions on or off, based on our preference or our needs. There's some platforms out there that will allow you to upload your own captions with your video content. You can also outsource captioning. You can pay somebody to do this service for you. So lots of different ways to accomplish making sure captions are available. The bottom line, again, is just to make sure that all video content has captions along with it. Next slide. So let's talk about the use of color in digital environments. So it's really important that we don't use color as the only means of conveying information. And this is because people will lose out on critical pieces of information if they have difficulty distinguishing colors from each other. So on the screen, we have an example of a standard color wheel and how that would look to people with two common red-green color deficiencies. And what happens is that the standard color wheel, many of those colors look exactly the same to someone who is colorblind. So, I'm not suggesting that we don't use color, right? Color can be very engaging and can help, present people information in a different way that helps people retain it or understand it. We just want to make sure that we also have some alternative way of understanding what this information means without relying only on color. So that would be doing things like adding lines in between pie slices on a chart, for example, adding some pattern or texture. Direct labeling is helpful. And of course, making sure that our charts and graphs have alternative text as well. Next slide. So again, here's an example of some different charts and how they would be viewed with different types of color blindness, and then how to remediate that. So in pie chart 1 in the upper left corner, this is a pie chart that's using color as the only way of conveying how the grade breakdown is being calculated between homework, attendance, participation, etc. So if we look at that pie chart that uses color only with total color blindness, so sort of a grayscale, several of those colors become exactly the same. And so a lot of the meaning that was presented by color, it gets lost for someone who would look at this with total color blindness. Again, if we look at that same chart with red color blindness, we lose a whole pie slice. So some of these colors look exactly the same. Again, this chart becomes pretty much meaningless to someone who has red color blindness. So on the bottom left, in order to fix this issue, we can leave our colors as they are and add some texture, which would help somebody who might not be able to distinguish the colors, at least be able to distinguish the various textures and still get a sense of, each of the pie slices there. We also see some direct labeling happening as well, which is helpful. And then on the bottom right, we have another better option, which is where the pie chart is just black and white. So good contrast going on there. And there's also direct labeling on each of the pie slices so that someone could interpret, the percent of each element and, so how much of the pie does that particular thing take up. Next slide. Again, in addition to using color as the only means of conveying information, we also want to be careful about our use of color contrast. Generally speaking, we just want to make sure we have high contrast. So that would be light text against a dark background, or dark text against a light background. We always want to avoid laying text over images because good contrast becomes harder to achieve in that case. Next slide. If you are wanting to be in compliance with the Web Content Accessibility Guidelines, there is a specific color contrast ratio that's required. Thankfully, we don't have to have these memorized. There are lots of color contrast checker tools that are available, that are web-based, so you can get to them just on a browser, or that you can download onto your computer and use them to check your color contrast if you're not sure. So the one on screen, the example on screen, is a program called Color Contrast Analyzer. I like this one because it's got the dropper tool where you can, use the dropper to grab the colors that you're working with. And then this tool will automatically calculate the color contrast ratio. And it will also tell you whether it passes or fails the Web Content Accessibility Guidelines requirements. So those requirements for text less than 18 point or 14 point bolded are that you have a color contrast ratio of 4.5 to 1 or more. And then for text larger than 18 point or 14 point bolded, the color contrast ratio should be 3 to 1 or more. So again, I'm not expecting anybody to memorize that. I just want to share with you that these tools are out there available, free to use and easy to find with just a quick Google search. Next slide. So with links, we just want to make sure that the links that we're putting in digital environments are meaningful. So again, people's assistive technologies can identify that they've encountered a link, and then we'll announce what the link text says. So rather than using learn more or click here, you want to put something meaningful behind that descriptive text. So rather than learn more, you can just link the phrase creating accessible link text. rather than leaving a naked link, which is like the URL with no descriptive cover text. So for example, https://rockymountainada.org. You would want to use descriptive cover text that says Rocky Mountain ADA Center's website. If you're linking to an email address, you want to spell that out so somebody knows that they are going to open an email client rather than a browser. And if you're in a situation like on social media where you can't use a descriptive cover text for your link, you can use a link shortener because, again, much of the problem comes from the fact that a person's screen reader or assistive device will announce every character of a URL. So using a link shortener keeps that, distraction or, it causes a issue of understanding if you have to sit there and listen to every character of a link. So listening to a shorter link helps kind of mitigate that issue. Next slide. So forms, generally speaking, online forms should have clear labels, clear instructions, and clear indicators when people have made errors. So clear indicators means that the form field will tell you what the error was and what you need to do to fix it. Next slide. So as I wrap up my time here, I just like to share some next steps. It's always helpful to create an accessibility policy, to run accessibility checks. There are many ways to do that. You can manually check the accessibility of your digital documents and communications. You can ask your stakeholders or people with disabilities in your sphere of influence to help check. There are automated checkers out there, for example, like what's available in all Microsoft products. Just remember that automated checkers have their limitations. So we want to, that gets us probably a good 75% of the way there, but it's always important to incorporate manual checking as well. There are lots of resources out there to help develop these manual checking skills. For example, Easy Checks, a first review of web accessibility. That comes from from the World Wide Web Consortium, who developed those web content standards. So great way to just dip your toes into the water if this is new to you. Always helpful if you can provide a way for the public to report accessibility problems. Start by fixing your most frequently used documents or pages. Develop a training program for new content creators. So people who are putting content out there, you want to make sure that they start with these skills, right off the bat, rather than having to go back and fix everything. You can prioritize working with vendors who have a commitment to accessibility. And of course, you can budget for accessibility as well. So if we'll go to the next slide. I've also just left some resources, some more links for where to go to develop your digital accessibility skills. These come from the Web Accessibility Initiative, WebAIM, Web Accessibility in Mind, and of course, resources from the ADA National Network. And next slide. More additional resources linked here. I know that everyone will have access to these slides. So resources related to digital accessibility in healthcare environments specifically, as well as more general training available through the Rocky Mountain ADA Center and the National Network. So with that, I will turn it back over to Katie, and hopefully we have a few minutes left for a couple of questions.
We do. Thank you, Emily. This is Katie speaking. So while you were talking, a few questions came in about the ADA's disability definition
Mm-hmm.
and who the ADA protects. So does the effective communication provision or requirement, does that apply to people whose disabilities might fluctuate? Or, some people, our symptoms are one way one day, and the next day we have different symptoms. Our disabilities change as we age. And does that matter at all for the effective communication requirement?
No, that doesn't matter. So as you just mentioned, Katie, disabilities can fluctuate from to person, day to day. Really, the only requirement is that there's some sort of limitation that impacts, a major life activity. It doesn't have to impact that major life activity every day or to the same level of severity every day. If it impacts your ability to communicate, the effective communication requirement remains the same.
Thank you. That was very clear and concise.
Mhm.
So another question was about how the effective communication requirement might apply to a pharmacy. And it was just sort of a general question. And I'm wondering if you could share some ideas about how someone might use this right in the context of going to the pharmacy to pick up prescriptions.
Yeah, absolutely. So a pharmacy certainly would fall under the ADA as a place of public accommodation. So I could think of some examples related to if a person is on a new medication and they need to speak to the pharmacist about that medication, but maybe they need a sign language interpreter to have that conversation. That would be one example of where those effective communication requirements would come into play. I know that when I pick up my medications from the pharmacy, there's often a printout of information about the medication. But, for people with low vision, that printed document, they might need that in a larger font. So they might need a large print version of that document. That would be a version of effective communication in a pharmacy setting. Again, in my experience, I go onto an application on my phone to refill my prescriptions. So if I was somebody who relied on a screen reader, I would need that application to be accessible and compatible with my screen reader in order for that process to work for me. So those are just a few examples that I can think of off the top of my head. But of course, always contact your local center, and we can have a more in-depth conversation about that as well.
Thanks, Emily. So, of course, there are questions about funding and resources.
Hmm.
And so I'm just curious if you could share any tips about funding to pay for auxiliary aids and services or funding to help pay for accessibility checks, or yeah, what advice would you give to people?
Yeah, so there's unfortunately not much funding available for Title II organizations. However, if you're a Title III organization, there are some tax incentives that are available. So they vary based on the size of your entity or your organization, but there are some credits and deductions that you might have access to if you are a Title III organization, that can help offset some of those costs. There might be grants in your area that you could look up if there are grants that could help with some of that funding. Um, it depends on a little bit on the auxiliary aid or service you're looking at, or the service you're thinking of. But often your local ADA center will have some more insight into that in your area. So you might want to follow up with your center to learn more about what's available in your region.
Okay, thanks, Emily. I think let's pause there with questions for now, so we have time for our next section of the webinar, and hopefully we still get more time for questions at the end.
Great. Thank you.
Okay, Jerry, I'll pass it to you.
Thanks so much. Yeah, Emily, the questions keep coming in. So clearly this is a needed topic. Thank you for that. We're going to move quickly through plain language and easy read. We have some resources on our website, so you can also check those out. But we want to talk more about what Emily introduced us to in the first part, which is strategies for making written information inclusive and accessible for all. I am here co-presenting. My name is Jerry Davison. Pat Swartz is my co-presenter. I'm going to just say I am the director of the Center on Disability, which is also the parent organization or department for the Pacific ADA Center. So you may know me from the Pacific ADA Center as well. And then I am going to let Pat introduce herself.
Hi, my name is Pat Swartz, and I am the lead technical assistance specialist for the Pacific ADA Center.
Thanks. And on this slide, there are a picture of 4 individuals. Some or maybe all have intellectual disabilities, and they are sitting outside and laughing and enjoying life. So next slide, please. As Emily mentioned, this one's just a disclaimer for the Center on Disability. Pat and I are not giving you legal advice. We're just trying to be helpful and help you all know how to make things more accessible. Next slide, please. Okay, what is plain language? So plain language is writing that is designed to make sure the reader understands things as quickly, easily, and completely as possible. Some ways to check if something is written in plain language is if the audience can find what they need, understand what they find the first time they read it or hear it, and use what they find to meet their needs. And so if you want to kind of think about what you're writing and look at that as kind of a checklist, that's a good start. Plain language is typically written at a 6th to 8th grade level, and we'll talk about how to figure out what grade level your writing is at in a little bit. Next slide, please. So why is it important to make sure your communication is easy to understand? I hope since you all are here, you know why, but just to go over some things, particularly about plain language, is it makes it easier for your audience to know what you're talking about and to follow whatever instructions or whatever they need to do. It can also save you staff time and money so that your staff aren't having to take extra time to go over things that are in writing. They may still need to do that based on the person's disability, but if you write it in plain language, there are some people who may not need that extra time for explaining. It's also inclusive of a larger audience. Obviously, we're talking about people with cognitive learning and intellectual disabilities with this today, mostly for this plain language part, but also plain language helps English language learners or those who are who use primarily a different language. Also individuals with lower education levels, that's another population that you can make sure you're serving better by communicating in plain language. It also helps build trust between you and the people that you serve if you're communicating with them on a level that they feel comfortable with. Next slide, please. And I will pass that one over to you, Pat.
All right, thanks, Jerry. So why is plain language necessary in healthcare? Plain language can improve patient communication, and it can ultimately mean the difference between quality patient care and high hospital readmission rates. Next. So it can improve patient communication. And here is a little bit about low health literacy. According to the first national assessment of adult literacy, conducted in 2003, only 12% of US adults had proficient health literacy. The majority, 53%, only had intermediate literacy. And the rest, 36%, had basic or below basic proficiency. That means that the vast majority of patients had a limited understanding of healthcare terminology and the healthcare system in general. So plain language can help prevent potential misunderstandings. And since most people have less than proficient healthcare literacy, misunderstandings are highly likely. And misunderstandings in healthcare can have serious consequences. Plain language can also make interpretations and translations easier. Translations for people who have English as a second language, or for people who are deaf and use sign language interpreters. So when healthcare providers use plain language in every step of the patient journey, it makes it much easier for interpreters to communicate the information. Next. So here are some examples of plain language. And you'll see later that in Word, in the editor section, you can find out exactly what grade level, according to Word, your writing is at. So for instance, the patient exhibited a significant elevation in diastolic blood pressure. Word says that's at grade 16. Instead of saying that, you could say your blood pressure was very high at a second grade reading level. Next, please utilize the provided medication as prescribed. That comes out at grade 14. Instead, you could say, please take the medicine as directed. Grade 6. The next example, we will need to conduct a thorough assessment to determine the etiology of the patient's condition. There is an app called Hemingway that will give you a grade level of 11 for this. And then you can change it to make it easier to understand in Hemingway and come out with, we need to find out what's causing your problem. And that comes out at grade 3. And I'll go down to the last one. The patient's condition is classified as an acute exacerbation of chronic obstructive pulmonary disease. Hemingway says that's grade 16. And you can make that easier to understand in Hemingway to come out at your condition is a sudden worsening of your lung disease. And that comes out of grade 6. We'll also talk about ChatGPT, which doesn't give you a grade level, but it does help you simplify language. And then I put it back into Hemingway and it came out at a grade 8, which is the patient is having a sudden worsening of their long-term lung disease, COPD. Okay, next. So when writing in plain language, before you write, you need to think about who your audience is and why they are reading your document. Language that is plain to some readers may not be plain to others. So if you're writing a document for the group of physicians that you're connected with, hopefully you would not give that same information to the general public or to your patients. Okay, next. So before writing, ask yourself, what does my audience already know about the subject? What does my audience need to know? And what questions will my audience have? So if you do that thinking before you start writing, you will be writing for your audience. Next. And here are some basic tips for plain language. Put your main point in the first sentence. Divide the information into sections with headings. Keep sentences shorter and clear. Try to use everyday words and avoid jargon. Think about how you would say the information in a regular conversation. Define any technical terms used and use lists or bullets when you have a series of items. And as a general rule, try to use bullets instead of numbers. They are easier to follow. Okay. Next. And use active voice instead of passive voice. And this is a rule generally in writing that's helpful for everyone reading your work. And if you use these 6 words, you can figure out whether you're using a passive or active voice. Use who does what in that order. So the first example is the medication was administered by the nurse. That's passive. Well, who does what the nurse does? So you start with that. The nurse administered the medication. Second example, the patient was reported to be feeling dizzy, and that's passive. Because who does what? You start with the patient. The patient reported feeling dizzy. And the third example of passive voice is the samples were collected by us. Who does what in that order? We collected the samples. Okay, next. And so here's a practice together. I'm not sure that I have all the time to read this, but this actually came from a hospital about patient instructions in education. And so think about the audience that this was written for. This instruction will include the patient's family, significant other and/or organization/individual responsible for patient's continuing care when and as appropriate. The family/significant other may be the primary learner. Resources shall be based on the patient's need and include but not be restricted to brochures, printed material, group and individual teaching sessions, audio videotapes, and internal or external resources. Education shall be adapted to age, culture, and religious practices, language barriers to be individualized to each patient, and must be offered in a timely, efficient, caring, and respectful manner. Nursing staff are available to assist you in learning more about your care at home. Individualized classes are held with you and your family, covering such topics as heart attack, diabetes, osteomies, and others. Arrangements can be made by notifying your nurse or social worker. So, what are some issues you see and what changes would you make? And Gabe, could you read the comments in the chat if there are any?
I think it may take a little bit for
Or
folks
Jerry.
to put those in there, but yes, go ahead and put some in there and as you see them, and we'd love to just kind of let everybody see what issues you see as you put them in there. We're gonna move on to the next slide just to make sure we cover all the content.
Okay.
But feel free to
Right.
think about what you heard that Pat read. I see someone saying, yeah, that last paragraph is the best one. There's some passive versus active. Great. Yes.
Okay.
Definitely
Thanks, Jerry.
definitely some words and some sentences that can be broken down.
Okay.
Next slide, please.
Okay, Jerry.
Yeah, so now we're going to talk about Easy Read. Easy Read takes the information and breaks it down a step further from plain language. So Easy Read may be required for individuals with cognitive or intellectual disabilities as a reasonable modification to your practices, or as we call it, more commonly, an accommodation. It also may be helpful for English language learners. So Easy Read has one idea per line, includes pictures to help explain the information, and is typically written at a 3rd to 5th grade level. And we'll show some examples of this on the next slide. Okay, so here is a form. It's a photo and video release form, and I thought this was a good example of Easy Read. It says use of photos and videos, and you'll see next to it, it's got a video camera and a camera with a photo next to it, and it says, over the past 6 months, we have taken photos and videos at the Supported Decision-Making Project. And then it says, the photos and videos may be of you, and there's another bullet point, your family. And so there's a picture of a family beside this line. And then it says WAIS wants to tell people about the work we do. WAIS may use the videos and photos for the website, the Facebook page, videos, brochures, and posters. And so there's a picture of a computer screen, and then there's a picture of a brochure. And it says, it's okay to say yes, and it's okay to say no. You can tell us if you change your mind. And there's an individual who's scratching his head. And then it says, we won't give out any information about you with the picture or video. We won't tell people your name or address. And so then there's just some pictures alongside of that one. And so it's helping the person with that visual information, and it broke each point up in separate lines. Next. So this is the continuation of that form. I'm not going to go into it because you all are going to get the slides. But one thing that's interesting about this one is it has the, it's asking the question, can we use these pictures? And it says yes, and it has a picture of a head shaking up or down, up and down. And then it has don't know, and it's a picture of a person shrugging. And then it has no with a picture of a head shaking no. And I thought about this because originally I was like, well, the yes should have a check mark and the no should have an X. But then that might imply that it's wrong to pick that answer. So I like the way they did the yes and the no with the head and the arrows. So, okay, we can move on to the next slide. This is another easy read example. I'm not going to go through each of those. You'll have the slides, and they are alt texted. But it says about mental health problems, and it says a mental health problem is when it becomes difficult to cope with your thoughts and feelings. And it shows a person kind of holding their hands up to their head like they have a headache. Then it says there are lots of different types of mental health problems. And next to this line is a person who's holding up a list that says 1, 2, 3. Depression is when you feel sad or down for many weeks or months. And it's got a person with their head down, and then there's a calendar showing many months. And so those are just some examples of how they explain those things. Next slide. So reading levels, we've been talking about what reading level plain language is, which is 6th to 8th, and for easy read, 3rd to 5th. What does that actually mean? So reading levels mean the level of education the average person needs to have to understand the content of what they are reading. How can you find out the reading level of your information? So there are several tools out there, and typically the way they calculate this are the sentences per paragraph, the words per sentence, and the syllables per word. So it's not perfect, because sometimes we have to use a longer word because that's the legal terminology, or that's the medical terminology, or whatever. But when we do that, we can break it down and define that. And so it's not a perfect formula, but it's a way to get it started. Readability tools cannot tell you whether the purpose is clear. They don't measure comprehension, but some tools are out there that can give you good suggestions. And so we're going to talk a little bit about those on the next slide. So some tools to check readability. One that everyone probably already has is Microsoft Word. There's a tool in there called the Flesch-Kincaid Reading Scale. Pat mentioned Hemingway earlier. We're going to talk a little bit about that. And then there's also ChatGPT. Next slide, please. So Microsoft Word, the Flesch-Kincaid Reading Scale is built in. There are ways to find this. If it depends on which version you have, but typically if you find the editor function in your Microsoft Word, it could also be under spelling or grammar. Sometimes you have to go to the advanced options to get the readability statistics, but a lot of times it's already preset that way. And so this is a screenshot of the Windows toolbar or ribbon, and it has the Flesch-Kincaid grade level outlined, and this one says 8.5. Something also that's cool about this tool is that underneath it, it also tells you the percentage of passive sentences. So that's just something to keep in mind as well. Next slide. Hemingway Editor is a writing tool. I think this is easier to use than the Word and the Flesch-Kincaid, because it can also give you some suggestions on how to improve it, or at least tell you what sentences may be difficult to understand and highlight those for you. So HemingwayApp.com is the website. There is a free version that gives some very basic stuff. I use the free version, but there's also a paid version that gives you some things above and beyond if you want greater writing help. And it highlights those sentences that are difficult to read. Next slide. This is a screenshot of what it looks like in Hemingway Editor, and you can see here it labeled both of these sentences in red because they are hard to read. The sentences say the museum maintains these collections and archive materials to provide historical content and documenting the past. The purpose is to foster an environment where meaningful discussion can be held with respectful discourse and analyzing the perspectives, prejudices, and patterns of the past to create a more all-encompassing present and future. Yes, so you can see why it may have said that. You can see there that there's a green box that says if you want to find grammar and spelling issues, you can upgrade it to Editor Plus. It's telling me on the right side that the readability is postgraduate, and it's telling me to aim for at least 9th grade. We know that we're trying to aim for at least 6th through 8th. So it does give you some stats in there, and I think it's a pretty user-friendly. Hemingway, HIPAA compliant. I'm jumping ahead because I saw that go in there. Do not put, it is not AI, and so it is supposed to be standalone and not, and it doesn't send it out into the world, but I would not put any patient identifying information in here. Take that out before you plug in anything in here, just to be absolutely safe. Next slide. Great question. ChatGPT is AI. You are putting that out there into the whole internet universe. It uses machine learning and understanding to generate human-like text. It does require an account, but it's free. It's at chatgpt.com, and you can use it to actually convert your language into plain language or easy read with the right commands. So if you're short on time or don't want to have to think through it, you can put it in there and it will say simplify this or make this plain language, or I wouldn't say plain language because I think that's still an underused term of art, but make this 6th grade reading level. Always reread it to make sure it's accurate and not biased. Unfortunately, artificial intelligence does have a disability bias. And then again, do not put personal or sensitive information into ChatGPT. Next slide. And this is just a visual of what ChatGPT screen looks like. There's a message box in there that says message ChatGPT, and the question above it says, what can I help with? And there are some different options under that. One of them is summarize text. But that what you're really wanting to do here is give it a command. And I think the next slide may tell you some sample commands. Next slide. Yes, so simplify this is an easy one to throw in there. And then if it doesn't simplify it enough, I say simplify this again and copy and paste the new paragraph it gave me. Or convert this text to a 6th grade reading level, or make this text easier to understand. And so there's an example on here that says, simplify this. Start your journey to success with BBB Learning's on-demand courses, certificates, pre-approved credits, webinars, and networking events focused on leadership and ethical business practices. Whether you're launching your own venture, leading teams, or tackling business challenges, BBB Learning offers opportunities to help you thrive in today's competitive landscape. Once we asked it to simplify, it says, start your path to success with BBB Learning. They offer courses, certificates, webinars, and events about leadership and ethical business. Whether you're starting a business, leading a team, or solving challenges, BBB Learning can help you succeed. So you can see where that is helpful. You may want to simplify it even more, and you can work within ChatGPT to do that. Next slide, please. This is just to show you some resources that we've created at the Center on Disability. The Inclusive Communication Project is a partnership we have with the California State Council on Developmental Disabilities. We have created 3 guides, a guide for businesses on plain language, a guide for governments on plain language, and a guide for service providers. They are very similar, but the information examples varies based on what type of provider you are and what what the legal requirements may be. So I wanted to share that with you all. I had that copied and pasted when I started, but I might have copied and pasted some other things since this webinar started. So I'm going to see if I can find that on there. But on the slides, this title should be a link anyway. So you should get that, and you can go to that page and check out the 3 guides. And then there's also some tips, just general tips on plain language on that website as well. Next slide, please. Okay, so we have a few minutes left for questions. So we can take those now. Katie, if you saw any interesting ones in the chat.
Thanks, Jerry. This is Katie. So you jumped ahead and answered that HIPAA question, but
Sorry.
which is great. But there were a couple of questions just about privacy and effective communication that came through while you were talking, while you and Pat were talking, that I wondered if you all could address. Just should people be thinking about privacy, or are there issues if, for example, you had an interpreter with you at a medical appointment, or if you needed if you use CART services at a medical appointment? There are a couple of questions just about, are there HIPAA privacy concerns related to kind of effective communication tools?
Sure, absolutely. And with professionals like CART professionals and ASL interpreters, they know those rules, and they are bound by those same rules when they're in those appointments. And so that's why it's always good to get someone who is a professional in that setting and not give in to any pressure to get someone who is not a certified interpreter or a CART professional. Those are just some things to think about. But also too, sometimes if someone needs plain language assistance, they may try and fill out a form with you and read it out loud to you, and you can ask them to read that in a private environment and not do that in a lobby around other people. So that's just something to think about. As a healthcare provider, you want to make sure you are offering the same privacy as someone filling out a form on a clipboard. So think about what spaces you may be able to take someone into to keep that information private. And then when using these tools, I think Hemingway is like a separate app you can download, and it is like a standalone, and it is not supposed to share information, but I don't ever trust like third-party apps. So I think it's always good to just redact that information before you use any of the tools we mentioned about translating language in, just to keep patients safe. Great
Thanks,
question.
Jerry.
Yeah.
So someone put a comment in the chat that I wanted to run by you both. They said that it sounds like plain language is a lot like direct communication, which is something that spoke to me as someone who identifies as neurodivergent or neurodiverse, that this sounds a lot like just how we want to talk, be really direct. And I wondered if you all could comment on plain language and directness.
Exactly. That's
Yes.
exactly what it is.
And I
Yes.
think, you know, we get communication all the time that we have to read 2 or 3 times, and we're like, why? You know, I have a law degree, but I still am having to read this 2 or 3 times to figure it out. And so Pat and I have had a lot of talks about, why did they write this way? And we find so many examples, even from, you know, providers that work with the disability community, that just aren't thinking through. And I'm a person who likes to use a big vocabulary. I love to read. I love things that are poetic, but still, it's just so refreshing when you read something that's more direct. So it's been a learning curve for a lot of our staff too. And I know Pat and I have learned a lot along our journey as well.
Can I just add one thing? The federal government is required to write things in plain language from the Plain Language Act in 2010. However, state and local government and businesses are not required to. There is no requirement for that. So you may find a difference between federal government websites and what they have to say, which aren't always so much, but yeah. Jerry?
Well, to clarify what Pat just said, because although there's not an explicit plain language requirement, they are required to make their language accessible. They
Yes.
are required to make their services and programs accessible. And that may be by communicating in plain language or easy read. And there are some interpretations of DOJ out there that make it clear that that's something that even those who aren't in the federal government need to be considering. And obviously you all are here today to try to be more accessible. So I hope you were, you know, working on that as well.
Jerry and Pat, I wanted to ask too, someone put in a question that was just, what would you recommend for a small organization to start working on website accessibility or effective communication or ensuring plain language? Kind of what's the one small step that maybe people could start with?
I think Hemingway is a great start for plain language. Emily, feel free to jump in here, but I think the built-in tools in Adobe for checking accessibility, and because I think a lot of folks post PDFs or send those out, that's a great built-in tool that tells you exactly what errors are in there. And same with Word as well. Emily, anything else you want to throw in there as far as first steps?
Yeah, I think it helps to just focus on the content that people access the most. So whether that's your homepage, your contact page, you know, where can you have the biggest impact on actual user experience? Start there. And there's lots of information, free information out there where you can learn about developing your own accessibility reviewing skills and whatnot. So you don't have to hire a big firm or review anything like that.
And this video will be going on the YouTube page, and you all will get a link to that so you can watch it. The resources, you will get the copy of the PDF with the link so you can go back and look at any of the tools that Emily, Pat, and I shared. And don't forget to fill out your evaluation because those are very helpful for us. And the links from the chat, if they're not in the PowerPoint, I think they all are, but if for some reason they're not, we'll look through those and make sure they get added as well.
Well, thank you, everyone. We realized that there's still a lot of questions in the chat, and I'm sure there are more questions for our speakers. And I'm sorry if you didn't get a chance to have your question answered, but we all work at regional ADA centers, and so please feel free to reach out to us to ask your questions. You can contact us over that 1-800 number. It's 1-800-949-4232. And I just want to thank our speakers today, Emily, Jerry, and Pat, for sharing their time and knowledge with us. It's a great presentation. Thank you.
And thank you
Thank you,
for the
everyone.
moderation, Katie.